Systemic lupus erythematosus. Hello, my name is Joya. I'm a student in Epidemiology, COH 315 at National University. And I'll be talking about lupus today. Lupus is a chronic autoimmune disease. The body's immune system becomes hyperactive and attacks normal and healthy tissue. Results in symptoms of inflammation, swelling, damage of joints, skin, kidneys, blood, the heart, and lungs. And here's a picture of common lupus symptoms, which are dryness of the eyes, butterfly-shaped rash on the cheeks, frothy urine, white or coloring when cold or stressed on the toes and fingers. The brain, you suffer from headaches, confusion, and memory loss. In the mouth, you get ulcers. Lungs and heart, you feel chest pain and shortness of breath. And joints and muscles, you feel pain, stiffness, and swelling. Under normal function, the immune system makes proteins called antibodies in order to protect and fight against antigens such as viruses and bacteria. Lupus makes the immune system unable to differentiate between antigens and healthy tissue, and this can lead to the antibodies going against the healthy tissue and causing swelling, pain, and tissue damage. Autoimmune disease is what lupus is considered, and it's caused by the problems in the body's immune system. It can be mild or life-threatening. Lupus is not contagious. It is known as systemic lupus erythematosus, or SLE. And there's different types of lupus, which include discoid or cutaneous lupus, drug-induced lupus, or neonatal lupus. And according to the Foundation of America, 1.2 to 2 million people have some form of lupus, and women are 90% of lupus sufferers, and it's most common between the ages of 15 to 45. Risk factors include 72% of Americans aged 18 to 34 haven't heard about the disease, and most doctors believe that both genetic and environmental stimuli cause lupus. And there's risk factors include exposure to sunlight, certain prescription medications, infection with Epstein-Barr virus in children, and an exposure to certain chemicals. And environmental factors include extreme stress, exposure to ultraviolet light, smoking, some medications, antibiotics, and the infection in Epstein-Barr virus in children. There's no cure right now for lupus, but the symptoms can be controlled with medication, and some medication are corticoid steroids, immunosuppressive drugs, or lifestyle changes. And there is other types of lupus, which are like the cutaneous ones that are found in the skin. And here again is a picture of symptoms of lupus. And this is an example of discoid cutaneous lupus, which is a version of the disease, and it's characterized by a rash that appears on the face, neck, and scalp, and it does not affect internal organs. less than 10% of the patients with discoid lupus progress into the systemic form, and there's no way to predict or to prevent the path of the disease right now. Age is a factor. Age-adjusted prevalence and incidence obtained in epidemiological studies are not homogeneous. So during childbearing years between 15 to 40 years, the diagnosis in women is 37 to 50 years across these studies. And lupus has an onset less than 50 years have been shown, and lower disease activity compared with onset below 50 years of age. Gender also is a factor, and it's most evident in childhood and late onset lupus, and female predominance rises with puberty. And lupus in the West African countries, the origin of the ancestors of many European and North American immigrant population, rates of occurrence appear to be low. The PAR due to heredity for familial lupus is 21%. Women with lupus have a fourfold increase for rheumatoid arthritis or lupus to remain significant after adjusting to environmental factors. Lupus is found worldwide, and ethnicity could be a factor, and it's found in some countries, and in every country, some ethnic groups appear to have it more readily. And in the United States, it's more common in people of color than in Caucasian population. So it includes African Americans, Hispanics, Asian Americans, Native Americans, Pacific Islanders. And also it develops at an earlier age, and it's more severe among members of these ethnic groups. Socioeconomic factors in many parts of the world, particularly in North America, minority population are often socioeconomically disadvantaged. Socioeconomic factors, access to health care, quality of care, compliance with care. It may be that the differences between minority and majority ethnicities can be exaggerated by these factors. Cigarette smoking is also a factor, and it could lead to the development of multiple autoimmune diseases, including lupus. There have been a number of heterogeneous studies of cigarette smoking and lupus, which suggest the risk of modesty increasing among cigarette smokers as compared to patients who have never smoked. In one study, current smoking was associated with a fourfold increase of positive dsDNA antibodies among lupus patients. Smoking may cause DNA damage, promoting the formation of dsDNA antibodies with a risk that reduces after stopping of smoking. The PAR for smoking or BMI, alcohol, parity, or breastfeeding collectively was 41%. And there's substantial epidemiological evidence that exists to support the association with cigarette smoking and the risk of incident lupus. Public health programs like the National Public Health Agenda for Lupus and the CDC, they're trying to monitor the long-term trends and the burdens of lupus. Their objective is to provide essential data to define and prioritize public health problems, identify populations most affected, guided solution, and monitor progress of the information. And they want to monitor the quality and timeliness of the care for people living with lupus. And they want to expand the study and the prevalence of lupus among racial and ethnic minorities using a variety of existing national surveys that accurately determine the burden of lupus. And they want to analyze geographic areas and demographics, encourage state to use national and state-based sources to determine the burdens of lupus, and collect data. There's also community programs linked to clinical services. They want to establish awareness campaigns on lupus, targeting a variety of audiences, create materials with effective linkages to organizations that present other diseases which may affect people living with lupus, such as cardio and vascular diseases. They want to expand the 2-in-1 system in all states to include pathways to access to care, clinical community, support programs for people with lupus, and develop and enhance local national clearinghouse capacity for people with lupus and their families, as well as healthcare providers. And they want to educate health state departments of the importance of implementing data collection systems for lupus or collaborating with lupus registries in their state. And here are my references. And that concludes my presentation. Thank you.